Pas de soleil, 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 pas de soleil.
Hey, oh dear. Hello. Good evening. This change of time between UK and Nigeria messed me up today. UK is now 1 hour behind, so I'm so sorry, but we shall still do it. So let's see whether more people will come on board so that we can start. It's terrible. It is terrible. It is terrible. I'm so sorry. I don't know why this. I was in another meeting and I thought 5 o'clock here, and I didn't think properly. So sorry, guys. You know, so only 25 people are online. That's not good enough. You know, let me see whether more people will come on. If not, I will take off irrespective of how many we are. Jonathan, good evening. Mike Nana, good evening. Rachel Adebayo, good evening. Kara Olive, good evening. It was terrible that you know, UK time moved back by 1 hour, so I got lost. So Chinonso, good evening. Choma Ozurumba, good evening. I think more people are coming. More people are logging. Adana Emeni Kekedo, Adaxi, how you doing? I hope you can hear me, guys. Blessing, good. Thank you for accepting my apology. Oh my God, sometimes you're flustered, you know. So Precious Waneri, welcome. Agbugwa, Ogechi, Egwekwe, Ijoma, Igwedi, how are you? Ebere Chikedu, how are you? How you doing? So I think we're already late, so I would have to kick off. If more people come in, they will join us. My name is Dr. Chin Akano, President and founder of the Timothy Akano Foundation. Today, the topic we are going to be looking at is contraception, family planning. Contraception, in a nutshell, is how to prevent unwanted pregnancy. What do you do to stop yourself from getting pregnant when you didn't plan it? So you, why we refer to it as family planning is, for married couple, how they plan their families, through contraception. So that is basically what contraception is how the methods that you adopt to stop you from becoming pregnant when you didn't want to be pregnant. That is what contraception is. So basically, I will talk about two broad types of contraception. First and foremost, we have what we call permanent contraception, and we also have a non-permanent contraception. Permanent contraception means that if you undergo that kind of contraception, it is not easily reversible. What it means is that it's not reversible. But before I go into the topic, there are a few terms that I'm going to be using that I would like to explain what they are. So if you understand what these terms are, then you will be able to follow my drift and understand the topic. The first thing is ejaculation. I will use that word ejaculation quite often. Ejaculation is that process whereby a man releases semen during sexual intercourse or following masturbation. So that release of semen is what is ejaculation. Then the next term is semen. What is semen? Semen is that liquid that the man releases when he ejaculates. Semen contains two types of fluid in it that is important for you to know. The semen contains spermatozoa, otherwise known as sperm, that is produced by the testicles, and it also contains another fluid known as prostatic fluid that is produced by an organ known as prostate. So when a man releases semen, that semen contains spermatozoa and also prostatic fluid. The work of the sperm is to fertilize the egg and make obviously have a baby, make a baby, while this prostatic fluid actually lubricates the channel, the tract, to make it easy for the man to release sperm. So that's what semen is. So anytime a man ejaculates, what he releases is called semen. It is not called sperm, because there is also prostatic fluid in that liquid. So that's what semen. I've discussed them. I've described them. What is semen, sperm, and prostatic fluid. Prostate is that organ that is like a walnut at the back of your rectum. So another word I like to discuss is ovulation. Ovulation. Every woman, normal woman, has what we call ovaries. So these ovaries release eggs, also known as ova. One egg is ovum. The process of the release of these eggs by the ovaries is known as ovulation. This normally takes place between 10 to 14 days, or 10 to 16 days actually, of a woman's menstrual cycle. The average is 14 days, but it can occur between 10 to 16 days. So that's ovulation. And you also need to know what is a woman's menstrual cycle. When you say a woman has a menstrual cycle, when is that menstrual cycle? The menstrual cycle is that period between the first day of their bleeding, of their period, when you start bleeding, that first day to the last day before the next period starts. So that's your menstrual cycle. From the first day you start your bleeding, of your period bleeding, to the last day before the next bleeding starts is your menstrual cycle. So 10 to 16 days in that cycle is when your ovulation is likely to happen. The first day of your menstrual cycle is the day the period started, not the day the period ended. So that first day so that's menstrual cycle. Another word we need to know, is fertilization. Before I talk about fertilization, you need to know what we call fallopian tube. Every woman has right and left fallopian tube. And the fallopian tube is that tube that connects the ovaries to the womb. And that is where fertilization takes place. What is fertilization? Fertilization is that mating or the union between the egg released by the ovary and the sperm to form the baby, the embryo. So that is fertilization, and it takes place in the fallopian tube. So that's ovulation. We've talked about fertilization. Another word that I'm going to be mentioning that I need to explain to you is implantation. So, what is implantation? If a couple have sex, the sperm will swim through the vagina, from the vagina to the fallopian tube, and then the egg is released from the ovary, and then the egg and the sperm meet at the fallopian tube and they fertilize and form a baby. So the baby stays in that fallopian tube for a little while. The fallopian tube is not suited to house a baby. So that baby will go down the fallopian tube and go into the womb, the uterus, and then get embedded on the wall of the uterus. That process of embedding of that baby in the wall of the uterus is what we refer to as implantation. So that baby will stay in the womb until the baby is ready for delivery, to be delivered. So that is what is implantation. I will be using these words along the line. That's why I decided to explain them in layman's terms. So let's go back to contraception then. Contraception is, we're going to be discussing methods to stop a woman from getting pregnant when she didn't want to get pregnant. So, like I was saying before, there is permanent contraception and there is non-permanent contraception. So, the permanent contraception, like I said before, is the type of contraception that is not reversible, not easily reversible. That if you do that method of contraception, you are going to live with it. And this method of contraception, permanent contraception, is only recommended for people, for a couple that have completed their family cycle. What I mean is that they've had all the children they want to have and they don't plan to have more. That is when this kind of permanent contraception is recommended. So, what are the permanent contraception? First and foremost, I will talk about permanent contraception in men, in a man. The permanent contraception in a man is also known as sterilization or vasectomy. Vasectomy. So what is vasectomy? Tommy is cutting. Vas is that tube. There's a tube that carries sperm outside. So you need that tube to release sperm from your testes to the outside. So that tube is called vas deferens. So vasectomy is the operation where that your tube is either cut or clipped or blocked to prevent sperm from moving out. So if you do have vasectomy, it means that you will not be able to release sperm, but you can release a fluid. I will explain. So that's what vasectomy is. So this vasectomy is a very short operation, doesn't last more than 15 to 30 minutes to do, and is done under local anesthesia. So normally, before you do this operation, you would have decided that you don't want to have children because it is not easily reversible. You cannot do it and go back and say, I want to do another operation to reverse it so that I can have children. So before doing vasectomy, you have to make sure that you have decided not to have children. And it's 99% effective. It's 99% effective. So what happens is that even after you've had vasectomy, you'll be advised not to have sex, or if you have to have sex, you need another contraceptive method like condom for at least 8 to 12 weeks. So the reason for this time is to allow the sperm that is in your tube to dry up. Because if you do the vasectomy and go ahead and have sex, some of the sperm in your tube may be released in there. So you will need 8 to 12 weeks after the vasectomy to have unprotected sex, to have sex without without protection for the woman, either condom or whatever other means of contraception. And then after the vasectomy, you will need to do what we call seminal fluid analysis. You will need to produce your sperm and you will be checked. And before you be given an all clear to go and fire on, you must have produced 2 clear seminal fluids. That means they've checked your semen twice and there was no sperm in it. Before you be told, go on, you're all clear, you can fire on, you are not able to impregnate a woman again. So after vasectomy, you are not able to impregnate a woman because you will not be able to release sperm. You will be able to release fluids. That prostatic fluid may come out, but there will be no sperm in it. So it's a very safe procedure, even though there are little side effects. You may have complications from the operation, like infection, or maybe your scrotum may be bruised, or may be swollen, or may be painful. Otherwise, it is a very simple operation. So that's the permanent contraception in men, known as vasectomy or sterilization. There's also permanent variety of this in women. It is called bilateral. Bilateral means 2 sides. Tubal, the tube. Ligation means cutting. So the tube, that your fallopian tube, where fertilization takes place in, is either cut off, or is plucked, or is clipped. So it's called bilateral tubal vasectomy, bilateral tubal ligation, or the clipping. So the tube I'm talking about here is the fallopian tube. So what happens is that if it's cut off, remember your ovaries are on top. So when you have ovulation, the egg comes down into the tube and waits for the sperm to come and meet it there for you to have a baby, for the baby to be formed, for fertilization to take place. But if you cut off the tube, the egg will not come through. That even if you have sex, the sperm that came through your vagina into the tube will not meet the egg because the tube has been cut off. I don't know whether so it is a permanent method. You can see somebody's asking me whether vasectomy is reversible. I said it's a permanent method of contraception. It is very difficult to reverse. So bilateral tubal ligation that I mentioned is also not reversible usually. So before you decide to do it, you have to make up your mind that you don't want to have children again. And most times women don't just go in and say, let's do a BTL, bilateral tubal ligation, what we used to call BTL. Maybe they wait until maybe they're having a CS. So at the time they're having a cesarean section, they will take that opportunity and have it done. Or if they're having a different pelvic operation, they can say, as I'm doing this operation, I want my tube to be tied. So, and this is also about 99% effective. 99% effective. It is not easily reversible. And what are the complications? What problem can you have from the operation? Possibly infection, pain, bleeding. So these are the reversible contraception. Vasectomy and tubal ligation or clipping. Then the other variety are the reversible ones. The ones that they're not permanent. They're not permanent contraceptions. Examples include your natural methods. Natural methods include things like checking your menstrual safe periods, your body temperature, the cervical secretions, or using condoms, or using pills, the one we call combined oral contraceptive pills, or using the other pills we call progesterone only pills. There are also injectables, injections. There are also coils, the one you put in the womb. There's the one we call copper T that is laden with copper. There's also another one that is laden with hormone that is called Mirena. We also have diaphragm and caps, vaginal rings. We also have implant, the one you put under the skin. You also have patches. So there are different kinds of contraception. There are too many. We will not be able to discuss all of them in one go. So I will take the ones I can take today, and then we take the rest later. But before I go into the types, let's talk about emergency contraception, which is very, very important. I need to get that out of the way. Emergency contraception is the contraception that you do after unprotected sex. So if, for example, you had an unprotected sex, or the condom got burst in and then or maybe the contraceptive you're using or the method you're using wasn't really effective at that point in time, and you needed to have protection from being pregnant, then that method of contraception is called emergency contraception. Emergency contraception. There are two types of emergency contraception that there are. A lot of women in Nigeria probably know about Posino 2. So that is the tablet form. So there are two types of contraception. Emergency contraception a woman can have if they had unprotected sex and didn't want to be pregnant, and they wanted to do something immediately to stop them from being pregnant. Number one is taking the pill. The pill is like Levonorel Postino 2, which is a kind of hormone derivative, what we call levogestrel. So, and there's one we call LO1, another one we call LO1. So I'm going to describe them. So the Postino 2 or Levonorel can be taken up to 3 days after sex. But the guidance is the earlier, the better. the earlier the better. But it is still effective up to 72 hours after sex. So that is Postino 2. So Postino 2 is not supposed to be taken as your regular contraceptive. It is only meant to be taken as an emergency contraception. You can take more than once in your menstrual cycle. That's that 28 days or whatever your cycle. The normal menstrual cycle could be 28 days, but anything between 20 to 40 days is acceptable. So that Postino 2 is not meant to be your regular contraceptive. You only take it after unprotected sex. Within 72 hours of that sex, you can have it. But it's more effective if you took it even just after the sex. The sooner, the earlier, the better. So, one, you can take it with, it does not really cause a lot of problem. It has been known that sometimes it can cause nausea, it can cause vomiting. It can also delay your period, your next period from coming, or you can make it come earlier or come later, or you can make your period painful. These are some of the problems you can have with that Postino 2 or Lemonel. It will not cause miscarriage for you eventually. It does not really cause a lot of problem. But remember, you shouldn't take it as your regular contraceptive. Every day you take it. And also, note that if you have sex today, and you took Postino 2 today, and decide to have sex tomorrow, you can be pregnant. It's not going to protect you from the next sex. So it only protects you from the sex you had before you took it. So just be clear on that. So don't... because I said you can take it within 72, that you can take it anytime within 72 hours. Don't just take one and then keep firing on and say you've taken contraceptive. The person that is asking me whether it has side effect, I just said it now, that Postino 2 or Lemonel could cause nausea, vomiting. It can delay your period. It can make your period come early, or it can make you to have painful periods or cause pain. This is what it can do, but it is fairly safe. So this is the tablet. There is the other tablet that's called Ella1, which you can take for up to 5 days after the sex. So that one lasts longer. You can take it, it's called Ella1. I don't know whether it's available in Nigeria. So this is what we call emergency contraception. That's the tablet bit. And it's very, very effective. But the more effective emergency contraception is insertion of coil in your womb, which we call IUD. So, let's say, for example, you don't want to take tablets and you had sex. Or if you took the oral, the Postino 2, and then you vomited two hours after taking it, and you'll be expected to take another one. Let me repeat what I'm saying. If you take Postino 2 now, and then within 2 hours of taking it, you vomited. So it means that Postino 2 you've taken hasn't stayed in your system. So you will need to take another one for it to work. So people who don't want to do that, or people who don't want to take tablets that want to prevent pregnancy, can have a coil inserted in their womb. It is called intrauterine contraceptive device, IUD. And the type we use is what we call copper T. It's like a little string with copper. It's T-shaped. Then it's put in your womb. This one is 99% effective. It's more effective than the tablet, than Postino 2. It is more effective than Postino 2. So the advantage of this one is that you can leave it there and leave it as your contraceptive ongoing, and then you will not be pregnant. Unlike the tablet that if you take it once, after 1, 2, 3 days, you can become pregnant again. While what the tablet does is to stop you from ovulating or delay your ovulation, or affect your ovulation. That's what the tablet does, so that you don't take in. But this copper T is in your womb. While it's in your womb, it's stopping the baby from implanting. Even if you become pregnant, it's not gonna, no way, you not get place where it go stay. So the baby will just be flushed out. So that copper T is like a foreign body releasing copper in your womb, and then it will stop the baby from implanting. And I've described it before. Implantation is that embedding of the newly formed baby embryo, the fetus, on your womb. So that's what that copper T will do. So copper T is more effective emergency contraception than the Postino 2 or Levanel or Ela1. But obviously, you need to go to see a doctor or a nurse to put it in your womb, and then you can leave it there. So what is the problem? Does it have any side effect? Obviously, like every other thing, you might have some pain while it's being inserted, but if you take paracetamol, the pain disappears. It may cause infection. It may cause infection that could lead to vaginal discharge. It can also cause, very rare, it can also cause very rare fungal infection we call actinomycosis. And sometimes the problem is that it can be pushed out without you knowing, and then you think you have a coil in there, and then you can get pregnant. If the person that is putting it doesn't do it properly, you can have internal injuries or while it's being put. But by and large, if the person that is putting the coil knows what they're doing, it is quite safe. So this is emergency contraception that you use when you have had sex, when you didn't have protection before the sex, or maybe your condom burst, or you forgot to take your pill, or you forgot to take your injection, whatever that you're meant to do that you forgot to do, and then you've had sex and you don't want to take it. So you have the choice of tablet and the coil in your womb. I don't know whether I'm making any sense at all. Am I making sense at all? Because I can't just be blowing and going, and I'm not. Can I get thumb up? Are you guys getting what I'm saying? No, the pain is not excruciating. It's a mild pain usually. So yes, the copper T has a little bit of a thread that is tied around your cervix. So a man with a very long organ may feel the thread, but not the copper T itself. So this is emergency contraception. So let's talk about natural contraception. Natural contraception. When I mean natural, these are contraceptive means that you don't need to take any tablet, or you don't need to have a patch, or you don't need to have a coil, or you don't need to take injections or tablets or anything. So there are natural contraceptive means. So what is the time? I'm not going to stay too long today because I have meetings upon meetings. So it's party. Okay, so let's go on talk about natural contraception. So the first one we're going to talk about is the one we refer to as coitus interruptus. Coitus interruptus. Coitus is sex, sexual intercourse. Interruptus is interrupting sex. So this is the one people also refer to as pulling out method. So this is the method whereby the man pulls out his penis from the female organ, from the vagina, when he is about to ejaculate. So when the man is about to ejaculate, he pulls out his penis and then ejaculates outside, not anywhere close to the woman's vagina. That is what they call coitus interruptus. You can see the problem in that method of contraception. there's quite a few problems. The first problem is there is something that is known as that's before pre-ejaculatory fluid. Some people also call it pre-cum. Pre-cum. This is that liquid that the man releases before the main ejaculation. Sometimes you see, sometimes a man is stimulated, you see a little clear fluid coming out from his penis. So that pre-cum doesn't normally contain sperm, but in certain occasions it may contain sperm, and then the pre-cum will be released in the woman, and then the sperm in the pre-cum will go and fertilize the egg, and the baby will be formed. So by the time you're pulling out your penis to ejaculate outside, the pre-cum has already done the job. You see, that's the problem with it. Another problem is that, withdrawing, that's withdrawal method, yes, pulling out method. Withdrawing at the height of passion, sometimes it is not easy. There's sometimes the man will set out to withdraw, and then when he gets to that time, you probably start singing non-dimities and forget. And, the willpower to pull out is not there. So that's the efficacy of this method is dependent on, on the man being very diligent about it, because it's not the woman, very diligent, that when you're going to be coming, you quickly pull out and make sure that your penis is far away from the woman's vagina, because if it's anywhere around, the sperm can also swim in. So that is another problem with this withdrawal method is, if after the first round you want to go another round, and you forgot to go and wee, because you need to go and wee to empty your urethra of any sperm, and then you must wash the tip of your penis to clean off any penis there. Sorry my people, to clean out any sperm around your penis. So if you forgot to wee and forgot to clean your penis and decide to plunge back for a second round, then the sperm that was in your channel before will be released before the main ejaculation. So that's another risk. So that's why withdrawal method or coitus interruptus is not such a fantastic means of contraception. But if you're very diligent, to do it clean, pull out when you are depression, and then if you need to go a second time, go and wee and also wash your penis, the risk of getting pregnant is lower. You only be risking the pre-cum, and usually the pre-cum most of the time would not contain sperm, but occasionally it does. So nothing is perfect. So that is one of the natural methods. Then the other one is what we call lactational amenorrhea method. I will explain it. Forget about the big name. Lactational is breast running. Amenorrhea is absence of period. So lactational amenorrhea method. So this is the kind of contraception a woman who has put to bed can use to prevent pregnancy. Lactational amenorrhea method. So what happens? The woman that put to bed must exclusively breastfeed to be able to enjoy this kind of contraception. So what happens is that if you're breastfeeding regularly for the first 6 months of that baby, of your baby, first 6 months, and you're breastfeeding the baby. So what happens is that each time the baby sucks the nipple, the brain is activated and there's a hormone called prolactin is released. This prolactin suppresses ovulation. So the more you breastfeed, and the prolactin would last in your system 3 to 4 hours. So that we expect that within another 3 to 4 hours, you would have breastfeed your baby again. So as you breastfeed your baby exclusively, your brain is releasing this prolactin, and the prolactin is suppressing ovulation. So on this can go on for about 6 months. That's why you see some women, after having their baby and they are breastfeeding their babies exclusively, even though they're having sex, they won't take in. It's because of the prolactin, that chemical that the woman's brain is producing each time the baby sucks the nipple, the breast. But it becomes a problem when you're supplementing the baby's food with milk, with cow milk, or the milk, animal milk or cow milk or whatever you're using. So what means is that there's a long gap between when you breastfed the baby and between the times you're breastfeeding the baby. So the gap may be long, that the level of prolactin in your system has dropped. So if, for example, you gave your baby breast by 12 o'clock and by 4 o'clock you gave him or her milk, your Actimel or Actamil, whatever one, or Cerelac, or whatever milk you give, and then you breastfeed again another 6 hours. So what will happen is that the prolactin level would have dipped, would have fallen, or maybe people that express big milk, express milk, it won't work if you're expressing milk for the baby to drink because you're going to work. It will not work. The only way it will work is that if that baby is sucking your nipple, your breast exclusively, and if you see your period, just know that it will not work again. So for that 6 months, amenorrhea, all that period that you're not seeing your period, is when your fertility is lowest. So that's what we call lactational amenorrhea method, LAM. The moment, I just want to add, there are some people that even within 2 weeks of having a baby, even when they have not seen their first period, they can take in because they may have had ovulation. So that can happen. So it is also important to be aware of that. But if after you haven't had your period and you're exclusively breastfeeding your baby for this 6 months period, your period is unlikely to come. And if your period didn't come, the prolactin will keep suppressing your ovulation, and you're not likely to take in. Am I making any sense at all? So, this is another natural method. So, we want to talk about safe period then. We need to talk about safe period. I think that's the one the Catholics use, or the ones they recommend. So that's it's interesting. So for you to use your safe period, you need to understand your cycle. You need to understand whether your cycle is regular. Like I said before, your menstrual cycle is from the first day of your period, the first day the bleeding started, to the last day before the next bleeding. So for this period to be very effective, you will be expected to have analyzed your cycle for at least 12 months for you to understand it very well. So if you understand when is your first day of your cycle and the last day of your cycle, you should be able to know when you ovulate. Like I said, ovulation, which is the process by which your ovaries release eggs or ova, normally occurs between the 10th to the 16th day of that your cycle. Remembering that the first day of your cycle is the day your last bleeding started. So that's when the ovulation that's when ovulation occurs. The interesting thing about it is that that egg that was released can stay healthy and fertile for the next 24 hours. So if you ovulated today being Sunday, that your egg is still fertile on Monday, 24 hours. Another thing is that you may release one egg today and release another egg tomorrow. So you can see, so if you release one today, it stays 24 hours, release another egg tomorrow, it stays 24 hours. So within that 48 hours, your egg is there, and any sperm that comes in contact would fertilize it, assuming that the sperm is healthy and the egg is healthy. Another thing, the sperm that comes into your system from your vagina can actually last in your system up to 7 days. So the problem then is that if you had sex today, Sunday, and you ovulated next week, Saturday, that sperm that came into your vagina and into your tube today can stay there alive looking for egg to mate with for another 6-7 days. So you can see timing this is a little bit of problem. So it means that you can take in all the way from a week before you ovulated to up to 2-3 days after you ovulated. So like almost 10 days. So you're not safe. I don't know whether I'm making any sense. So that your sperm, that the man put there, can stay there and be looking for egg for almost a week. So you wouldn't say, oh, I had sex on Wednesday. Because I had sex on Wednesday, I'm safe to have, the sperm would have died. So my ovulation is coming in 3 days' time, it's fine. No. So if you work out your ovulation and find out that you're going to ovulate on 10th, for example, 10th of January, for example, if you have sex on the 3rd, you're still at risk. So you need to avoid at least a week from your ovulation. Take it back and remove at least a week. And then after the ovulation, you also have to give room for another 2-3 days that your egg will be alive and still fertile. I don't know, does it make sense? So this is the thing about the this safe period. It is not easy. And also, if your cycle is not regular, what I mean is this. There are some people who can tell you that I'm coming on the 10th. Dead on the 10th, they will come on. The period will start. Dead on that 10th. My period is on 28th. It jumps every 2 days. You know, it's like a clock. But there are some people that they can't even time their period. They don't know when it's coming because today is 20 days, the other day is 28 days, the other day is 32 days. With that kind of period, it's difficult for you to calculate your safe period. It's difficult. See, that's the problem with this method. So, and there are also some medication you could be taking that would affect your cycles. So if you're on certain medications, your cycle, calculating your safe period may be dicey. Okay, so let's move on to another natural method, which some people call Billings method, where you use your cervical mucus secretion to analyze when you are ovulating or when you are ready to you're most fertile. So normally after your period, okay, for you to check, you need to use your middle finger and put inside your vagina and then kind of jolt your knuckle up to see what you get on your finger. Normally, after your period, if you put your finger there, the vagina is usually dry. But when it's approaching like the 7th day after your cycle, you start having discharge that is usually creamy, and wet. Then towards the 12, 13, 14 days, the discharge becomes like egg, the egg white albumin, becomes wetter, becomes more wet and thicker. So at that time that your discharge is like that white of egg is when you're most fertile. That is when you're most fertile. So that's what they call Billy's method. Using this, your vaginal discharge, your discharge that comes from your cervical, the cervix is the neck of your womb. So that's where that discharge comes from. So the change in the consistency and texture of this discharge is what you can use to know when you're fertile and when you're not free, when you're free. So that time that is dry, you're infertile. But when you start having it and it starts becoming thick and start becoming creamy and drawing like draw soup and then like egg whites, they just know that don't try anything at that point in time. So there is also the temperature method. So the thing is that if you use the safe period calculation plus the temperature method, which I'm going to describe now, and this cervical secretion, if you can do the 3 and be recording it, you will be able to avoid pregnancy more. But if you just use only one, chances are that it will be hit and miss. The temperature method is that you have to, every morning, before you eat or before you drink or before you smoke, you will need to check your temperature. And there are certain thermometers that you can use for that. We normally use digital thermometers. Digital thermometers are the ones that you can maybe put under your armpit, or the ones they put in the mouth, or the ones they put in the anus. So all these thermometers that we put in the ear or this thing, they are not advised. So you will need to check your temperature every day and then be recording it. So there will be 3 days that your temperature goes up slightly by maybe 0.2 degrees centigrade, or if you're in Fahrenheit, 0.4. So that 3 days when your temperature has gone up is when you're least fertile. So that's the temperature method. That's when you're least fertile. So if you can use that temperature method plus the cervical secretion method, as well as your menstrual cycle, if it's regular, you will be able to analyze your fertility period and know when to avoid sex. So this is the natural method. So I will reiterate, because I don't want to go into the other ones, because it will take, for me to finish topic on contraception, I probably have to talk for 4 hours. And I just want to break it so that at least things are easy and you understand what I've said, and so that if you ask questions, I'll be able to answer you. So the natural method, where you don't need to take medication, would involve, I talked about coitus interruptus, which is the withdrawal method. I explained the problems that are associated with that method. Precum, which is that pre-ejaculatory fluid, which is the fluid that the man releases before the main release, which is little, which does not usually contain sperm, but in certain occasions it contains sperm. So that sperm is capable of fertilizing an egg. So that's a problem. Number two, if the man is not very diligent, when you want to come, like, and then you just you just come, but your plan was to pull out. It's not always easy to pull out. So that discipline and that ability and that diligence to ensure that you pulled out at the nick of time is a problem. And number three, if you're the type that after one round you want to go the second one and you forgot that you haven't weed and you haven't cleaned the tip of your penis, then that coitus interruptus will fail because they are still spermatozoa in your urethra. Urethra is that tract where the sperm flows out from and goes into your vagina. So that's coitus that's the withdrawal method. Then I talked about the lactational amenorrhea method. Lactation is breast milk, the process where you're producing breast milk and feeding a baby, and then amenorrhea is cessation of your period. That's you're not seeing your period. So, and that is only for women that just gave birth who are exclusively breastfeeding their babies, and it can last up to 6 months. So if their baby sucks on their breast, the signal is transmitted from their breast to their brain, and they produce that hormone called prolactin, and that prolactin suppresses ovulation. That's why some people who are not pregnant that suffer from that condition we call hyperprolactinemia, they have a lot of prolactin in their system, and their breast runs even though they didn't have a baby. And when they have that condition, they find it difficult to take in. So that's the same mechanism that this follows, this LAM, lactational amenorrhea method follows. So, but the baby has to be exclusively breastfed, and you have to be giving the baby breast. The baby has to be sucking your breast. You're not going to be squeezing and giving the baby. So it's through that sucking that the signal goes to the brain. So that's lactational. Then we talked about the safe periods, method, where your period has to be regular. You have to calculate when you're ovulating, because obviously you're not going to take in without ovulation. And that normally happens between the 10th and 16th day of your cycle. And remember that the first day of your cycle is the first day the bleeding started. So if you want to count your cycle, start from that day the bleeding started. Day one, your bleeding starts today. This is day one of my cycle. So from there you count. Monday to 1, 2, 3, 4, 10th day. I'm about to start ovulating. So ovulation can happen anytime between then and the 16th day. You can release one egg today and release another egg tomorrow, and your egg can stay alive and healthy for another 24 hours. So if you have two, one coming today, one coming tomorrow, then what it means is that you have eggs that are there for at least 2 days waiting for a sperm, and then the sperm can last for a week. So, if your egg dies and you've had the sex, you have sex, before your ovulation, maybe a week before your ovulation. So don't say because I've passed my, I had this sex more than a week or more than 3 days ago, more than 2 days ago, I'm not going to take in. That sperm that came in there can stay there for a week and wait for the egg to drop. So you need to be cautious of that. We also talked about the secretions, the vaginal discharge that changes in consistency and texture according to your cycle, from dryness to when it becomes a little bit liquid, and to when it becomes dry like draw soup, and like egg white, and that's when you're most fertile. And then the temperature method. So these are all the natural methods. So I intended to cover emergency contraception, natural contraception, and permanent. So for the purposes, for the benefit of those that just coming in, we've talked about the permanent contraception, vasectomy, and tubal ligation. Okay, so these are the contraceptive methods I want to talk about today. We will talk about as simple as it sounds: condom, the male condom and the female condom. Many people may not even know that we have a female condom, which is femidom, that women insert in their vagina, if the man didn't wear a condom. So you won't say the excuse that the man didn't come with a condom is no longer enough, because you can wear condom yourself, female condom. So we'll talk about the male and female condom, talk about the injections, the coils, the tablets, So I didn't want to lump everything together and confuse us. So that's why I just decided to go sequentially, and at least anybody, the reason why I talked about emergency contraception today is in case this night something happens, at least you know what to do, and you won't say, oh, I had this sex tonight, I can't help myself. You can go tomorrow and get Postino 2 or LO1. LO1 lasts up to 5 days. Postino 2 can last up to 3 days. Even but the sooner the better you take them. And okay, we eventually got there. We got there at the end. I don't know, this time that changes in UK is crazy, So let me see whether I have any question. I hope it was enjoyable at least, and I made some common sense. I didn't confuse anybody. Let me see whether there are questions. I know usually when I look for these questions, they don't come true. Let me see. Maybe when I have ended the video, let me see. Today is my birthday. Oh, Precious, happy birthday. Why are you crying? Sorry, you shouldn't be crying on your birthday. You should be jollicating. Happy birthday, Precious. Yeah, Eberechi, yes, permanent and non-permanent contraception. But that is for people that have completed their family cycle. They don't need kids again. Or unless you're Yibo, they don't want to have children, so they can just go and do the snip instead of bothering themselves with condoms and all these processes. They just, go and snap off the thing, and they won't be able to. Yes, Eberechi, semen contains 2 types of fluid: prostatic and spermatozoa. Yes, you are right. Nara, nara, narekele, nareke. Yes, Jonathan, you got it. That's what is the menstrual period. Juliet Obimara said, I didn't get what ovulation means. Is that the question? Wow. Ovulation is the release of egg from your ovary. That is what ovulation is. Ovulation. Release. Your ovaries release eggs once or twice in a month, but at the same time. So the ovulation period is usually between 10 and 16 days. You can release 1 egg today and release another tomorrow. So that's what is ovulation. If you're not ovulating, you will never take in. So you need an ovulation to occur for a sperm to fertilize, because it's the sperm that mates with the egg to form the baby. Upright, how are you? The lady with the nice name, Upright. So, any other question? Doc, you seem tired. I'm not tired. I was flustered that I was looking at time, and I was thinking that it was still 5 o'clock, because UK time is 1 hour behind. And you know, our time it changes twice a year. So I totally forgot that we were 1 hour behind Nigeria. Narekele. Only vasectomy na work. Why is vasectomy na work? It's not. A lot of Oyibo people do it easily, but you know, Nigerian men now, you know, won't agree to submit themselves for vasectomy. You know, no, men actually do it. They do it overseas. Here, I know that the take-up level in Nigeria is low, but over here, they do the snip all the time. You know, Igbo men are not selfish. They just come, instead of their wife going through all these taking of pills, doing that and all that, or having a coil and having infections or whatever, or bleeding, they just go and, you know, block their vas and cut it, and they don't produce sperm, and their wife is free. You see? They love their wives more than we do love our wives. Blessing Chidima, he said, after vasectomy, does the testes stop producing? Vasectomy has nothing to do with production. Vasectomy is cutting of that tube that transports sperm out. So if it's cut, the sperm that will be produced cannot be expelled out. So if the man ejaculates, semen without sperm is released, because the prostate also releases what we call prostatic fluid. But that fluid will no longer contain sperm, because the channel through which that sperm would have traveled has been blocked. It's like when you block tap. If you turn on the tap, will the tap run? If you block a pipe with a plug and plug it, if you turn on your tap, the water will not run now. So that's the same process. Please, sir, is vasectomy reversible? That is the reason why I said that vasectomy is a permanent contraceptive. It's sterilization. Sterilization, it is not a very easily reversible condition. In fact, it is taken to be irreversible. Because for you to go back and say, I want you to join these two back, no be small work. So it is not, if you have not decided not to go on with it, don't do it. Don't do it, because you're probably not going to have success. Oh my God. So some of the questions that I'm seeing make me feel that people don't understand what I'm saying. Adana is asking me, is ovulation before or after menstrual flow? Meanwhile, I explained here clearly that the first day of your cycle is the day your period started, the day you saw bleeding. That first day you saw bleeding is the first day. And your menstruation is 10 to 14 days after then. So, if you understood that, asking me if ovulation comes before menstrual flow, how far? You would have seen your period, and your period has ended, isn't it? Then from that first day that the period started, your ovulation will happen 10 to 14 days to 16 days after. Queen said, I don't understand permanent contraception in women. I don't know whether you have understood it now, when I explained that the fallopian tube is either cut, or is blocked, or is clipped. It is clipped to stop the egg coming from the ovary from getting down to where the sperm can meet it. If you have sex, the semen that contains sperm would be deposited in the vagina, and the sperm will swim from your vagina and get to your fallopian tube and wait there. While the egg will come from the top, from the ovary, which is on the top of your tube. The ovary is on the top of your tube. So when the eggs are released, the eggs come down, or the egg come down from the ovary, which is at the topmost of your tube, and then come to the part of the tube, which we call ampulla. It comes there. That is where the sperm comes to meet it for them to form a baby. But if you block or cut off that tube, cut it out, even when you ovulate, the egg cannot come down to that point where the egg meets it, or where the sperm will meet it, therefore preventing fertilization. So with that cutting, with that ligation is cutting or clipping, fertilization is prevented. Fertilization being the process by which the egg and the sperm meet together and fuse and form the embryo or the fetus or the baby. So with that clipping of the tube, there will be no fertilization. And without fertilization, there will be no implantation, because the baby needs to be formed for it to go down the tube and go into the womb and stay. So that is what it is. And like I said, usually if a woman decides to have this procedure, it is always more convenient to do it when you're doing another operation. Maybe you're doing a CS to have your baby, and you take that opportunity to have your tubes clipped or cut or plugged. So that's what I hope you have understood this permanent contraception in women, Queen. If you didn't understand it, please ask again and say exactly what you Deborah said, I just joined. I have plenty of questions to ask. I don't know. People said women that do have tubal ligation always have issues with conception in their next life. I don't know anything about reincarnation. I don't talk about reincarnation. I'm not an I have got nothing, no information, no knowledge of reincarnation. Only ask me about medicine. Don't ask me about spiritual or supernatural things. If your cycle is not regular, calculating your safe period will be difficult. It will be difficult. But if you use the temperature, and the cervical secretion system method, you may be able to tell when you're ovulating. So let me see whether UK, how are you? Yeah, Sandra, the earlier you took the emergency contraception in terms of the pills, Postino 2 or Ella1, the better for you. Yeah, does it have side effects? I don't know what you're talking about. You mean the emergency contraception or morning after pills? What are you call morning after pills? Yes, it can cause, I said, nausea, vomiting. It may affect your period. It may cause all that. Yeah. It have bad effect, right? I hear you. For last year, what side effect does vasectomy have apart from inability? Operation will not have side effect. What do you mean complication? If you mean complication, I've said it before. The complication is that you may have infection after the operation. You may bruise your the man's scrotum, or the scrotum may be inflamed or may be in pain. Unless the person that did the operation made a mistake Otherwise, there's no issue, long-term issue per se. You know. Yeah. There are more. Yeah, miracle. And then you have to slow down and wait for me to talk about the other types of contraception before I start telling you about the side effects. But at the moment, I limited myself with the permanent, emergency, and the natural. So you should limit your questions to those ones, so that I don't. Yes, for last day, if you took Postino 2 and vomit after 2 hours, then you need to repeat it. Then if it's the L1 that you took and you vomit after 3 hours, you have to repeat it. I mean, why? How would the man? I mean, if you're fingering your wife, and then your finger may touch the thread of the IUD, and then it's possible to pull it. And if you pull it in accidentally, you can injure the womb. It is possible to injure the womb. Yes. The pain of fitting the IUCD is not excruciating. It's not usually excruciating, but it can cause pain, obviously, which painkillers can, relieve. So, Jaina Constance Oji. Hello, how are you doing? We stop. Yeah, all right. It looks like no more questions. When I drop now, the call, does it stay forever, or has it a day? What you mean is that coils do have expiry. How long they should stay in your womb before you change? I will talk about coil in detail, the types of coil, IUD, IUS, next time, and then I will explain all the duration, all their problems. So, I don't think very few men came on board today. That's not nice. It's only, well, we'll continue pushing on. Yes, Chinedu Ebo pre-com. Yeah. Jonathan, this guy is very mischievous. WWE runs, yes, so. Yes, Fola, yes. Pre-ejaculatory fluid, yes, it may contain sperm. She called the leader. Withdrawal method, he know easy, my dear. You know easy. You might, set out to withdraw, but when the time comes to the time, your body will be shaking and your waist, you won't know before you know it. Sorry, you just come. So I don't ever recommend withdrawal method as a means of method of contraception. To be honest, it is one of the most unreliable. To me, it is unreliable. But obviously, if the man is very diligent enough and follows all the guidelines, and then the efficacy, is higher. Yes, until you stop breastfeeding, you don't use contraceptive. Yes, that's what we call lactation amenorrhea method. Yes. Oh, little bit. Okay. Oh. For last year, you're talking about lactational There's nothing that works for everybody, but it works for most women that are exclusively breastfeeding, especially at least as long as they have not seen their period. But if you see your period, then it wouldn't work. Or if the baby is more than 6 months, or you're giving the baby alternative feeding, then or you're sucking out breast to give the baby because you're going to work and things like that, then it won't work. It may not work. Can combination 3? I don't know what is combination 3, to be honest. Where's my... What happened? Okay. Looks like the questions are finished. Some women ovulate during menstrual period. How true is it? It is not scientifically possible to be ovulating while you're having your period. It is not scientifically possible, but anything can happen in medicine, but it doesn't make scientific sense. Thank you, Deborah. Oh, let me spam the fertilizer. Oh my God, that's why it's there. Spam. Not the blessing. Why is period between 26 to 28 days if eggs last for about 24 hours? It's not a question. If your period is irregular, not menstruation, if your period is irregular, then unless you use other methods to track it, but safe period will not work. May not work. It becomes unreliable. Some of the questions that I'm getting, what of a person that has 18 to 21 days interval of menstruation? I don't understand what's the question. You know, I said your cycle can be between 20 to 40 days, you know, and it's normal. So if your period is within 18 to 21 days, I mean, it's not abnormal. Oh, okay. So I hope we've learned something. At least those of you that came on board will go home with something tonight. You know, at least something. And don't go and take in when you didn't plan to. But for the single women, all these contraceptive methods, none of them will protect you from sexually transmitted infections. So condom will be the right way to go if you are a single woman who, you know, and you're not sure of your partner, because, you know, apart from the scare of getting pregnant, the worst scare of catching sexually transmitted infection, HIV, hepatitis B, C, herpes, syphilis, or tangari, or what have you. So condom is the right way to go. If you are, don't worry, I'll discuss you know. It's good that you're avoiding sex, but it's not because your period comes out like magic. You know, if what you're avoiding is pregnancy, then that's the essence of contraception. You know, if assuming you don't want to get pregnant, you may even get married and you don't want to get pregnant yet, you still have to use a contraceptive means that is suitable for you, you know, for your age and everything. So, you know, natural methods are not reliable when periods are not regular, but obviously, you know, we have condoms, we have pills, we have coils, we have injections. I mean, I always advise coils for people who have children, you know, but normally you can have pills if you don't have contraindications. You know, you can take injections usually once every 3 months. You can put patch, you can put implant in your skin that can last years, 3 years, 5 years. So I'll talk about them another day. You know. How can this topic be corrupting you? I don't understand. It's teaching you how to look after yourself. You know, it's not corruption. For you, how would you know whether African men undergo vasectomy when you don't work in the hospital? They do, but obviously not as common as less selfish white people, white men. Peace Akban, there are women, some women that got their menstruation after 3 months of their delivery. Can they become pregnant? Yes. The moment your period starts, then you can become pregnant. Even though you can become pregnant even before your period, because obviously ovulation may have taken place. Sandra, you want you want to hear about the female condom? All right, you will hear about it so that you can carry it in your own bag and you don't have to ask a man to wear it. You wear it your own yourself. But just be aware, it makes noise. Fuck, 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 fuck. It makes noise, you know. It's quite noisy. Some people don't like the noise of the female condom. Yes, Marco, there's female condom. He says it's for spoiled women. It is not using condom is not about being spoiled. It's about being reasonable. It's about being sensible. It's about being safe. All these diseases that people carry, you know, they are scary, isn't it? They are scary. So it's safer for you to have your own condom if the man doesn't want to wear. Do you know that some men are funny? I used to know a friend who is late now. He didn't like condom at all. So if he had he was going to have sex with somebody who insisted on condom, he will wear the condom and then he will use his nails to make a little tear the condom on top, a little bit on the tip. So as he's thrusting, the condom is giving way. As he's thrusting, the condom is giving way until the condom just goes down and to the middle of his penis, you know. So that's what you used to do. You just tear it a little bit at the tip and then wear it. So if the woman has their own femidom, her own condom in there, at least she's protecting herself against this kind of men, you know. Yeah. So guys, Chukdi, how are you? Yeah. The tube doesn't grow back by itself. The tube doesn't grow back by itself, no. Ella Bob, I've answered the question. Normally, you should not ovulate during your periods. There are always abnormalities. There are always exceptions to the rules. I can never say never, but you shouldn't ovulate during your period. Lisa, I don't understand billing method. I will save this lecture, the live session. I'll save it. Please go back and listen to it after. So, Oleb, I hope I've answered all your questions that Berekete. Mwachuku triplet. Chigozie, can irregular menstruation cause problem of conception? Irregular menstruation by itself or on itself should not cause infertility, unless the person has a medical problem, another problem that is also associated with this irregular menstruation, that may affect fertility. But on its own, irregular menstruation shouldn't be a cause of infertility. A lot of women have their periods. A lot of women, their periods are irregular, all over the place, but that doesn't stop them from conceiving. If anything, it makes it difficult for you to track when you're fertile. So you can take in at any point in time, because you don't know when you're ovulating, unless clearly you're checking your temperature or doing the cervical secretion method. Erudite Grace, thank you. Sandra. Elijah Kalechi. Yeah, the teaching is almost for the ladies, because vasectomy doesn't happen in ladies, it happens in men. And then you can also advise your wife or your girlfriend what to do. There's no knowledge that is wasted. Bibi and Chinon. So ovulation is not something that lasts in days. Just that is a process. As soon as your ovary release your egg, that's ovulation. That's all. The process by which your ovary releases the egg, that is what ovulation is. It's not something that lasts in days. It is the egg that was released that can stay in the system and be healthy and alive for 24 hours. Yes. Oh yes, when your under is dry, just do without fear and run when it's wet. You got it. You got it. Got it. I like people that understand them. Yeah, wisdom. Yes, of course, without ovulation, a woman won't take it. Never. Yeah, if a man has had vasectomy, there will be no sperm to deposit. Onyinye Sonia, thank you. Thank you. Thank you, people. Yes, abstain if you don't understand what ovulation is, isn't it? Just go home and stay there in peace. Yeah. Thank you, Jen. Thank you. I don't know about natural being the best. Chidima, it can work, but I don't know about being the best. Bibi and Chinonzo, ovulation doesn't start. Ovulation happens. So if your period is from today, 22nd, and that is the first day of your period, you may have your ovulation. Don't say your ovulation started. You will say ovulation occurred on. So 22, 23, 24, 25, 26, 27, 28, 29, 30. By 1st of December, yes, being the 10th day, you're right, from the 1st of December, you'll be expecting that you may ovulate. From that 10th, 11, 12, 13, 14, 16th. So, no, 1st, 2nd, 3rd, 4th, 5th, 6th. So, till about the 6th of December, But remember that the sperm that you had deposited a week ago could fertilize you on the 1st. Alright. Okoro Laura Lancy. Wow. You just coming on board? Alright. I'm gonna be going now. Oh my God. So, girls, ladies and gentlemen, or if there's any gentleman at all, I shall go and rest my bones. It has been a busy day that I forgot that the timing of UK is different from that of Nigeria. And I was waiting for 6 o'clock in UK, not knowing that I was already 20 minutes into 6 o'clock. Oh my God. My friends who think they know it, okay, no more questions. I will Alright guys, take care and thank you for coming on board and logging in and being with me. I'm happy that at least reading the questions give me the joy that, you know, most of you took something home. Even if it's one thing you took home, I'm happy. Alright, so we'll find another day to talk about other contraceptive methods. Condoms, male and female. In fact, there are actually a lot to know about even the male condom. You know, there are a lot, a little bit more than you think. Then the female condom, and then is, injection. At least the injection is quite nice because young ladies can have it once in 3 months. We'll talk about the pills, which you have to take every day, or types of pills. They will have patches and all the other types. My fear is that if I lumped everything together today, we'll go sleep here, and then people will just be confused. So it's better to fragment it, and then hopefully we'll get there at the end. All right. Good night, ladies and gentlemen. Remain blessed. One love.